Everybody. Hello, everyone. I'm Rob Fraser, President, Chief Scientific Officer, and founder of Molecular U. And I'm moderating a discussion today on how we're moving our practices in the clinic to more proactive rather than a reactive as we start to move more into longevity, as more and more people want to stay healthy longer and hopefully extend their lives much longer. So in our discussion of next-gen healthcare, I'm really excited to be hosting Sherry Dadgar and Jim Donnelly. And we hope to have Fady Hannah Shimoni join us shortly. He's a little bit delayed. So we're going to begin with some quick introductions of our panel members. And the first one I think we'll start off with will be Sherry. Sherry, do you want to begin?
Yes, sure. Hi, everyone. Nice meeting you. My name is Sherry Dakar. I'm board certified clinical molecular geneticist. I'm the founder and CEO of Personalized Medicine Care Diagnostic, which is a CAF and CLIA diagnostic lab located in Maryland, United States. Thanks for the opportunity to participate in this webinar.
Thanks, Sherry. Jim?
Yeah, I'm Jim Donnelly. I'm the CEO of Humanot Health. Humanot Health is a place to come for health optimization. We do it in clinic via telehealth and through an e-commerce platform. The only other thing I'll add is I've been in the health, wellness, and fitness space for the past 20 plus years and have had several pretty high profile businesses like Restore Hyper Wellness, I Go You Go, which won a Webby Award for the top travel site in the world. And I'll bring that kind of all together as we talk about things, because I do think that making big improvements in this space involves creating an ecosystem that has things from a medical perspective, but also other things to kind of tie it all together.
Yeah, great point. Oh, and just perfect timing, Fady. We got you just in time. So we're just going through our introductions. Do you mind giving us a brief introduction for yourself, for our audience?
Yeah, hi everyone. Sorry I'm late. My name is Fady Shmouni. I'm a clinical endocrinologist and geneticist from the NIH, currently living between Washington, D.C. and Toronto, and I mostly do venture building in health and wellness today.
Venture building. Wow. Okay, we look forward to hearing more about that. So we thought what we'd begin with today in our discussion is really give us your opinion, first of all, where you see clinics in general moving, or do you see clinics in general moving? Has there been a barriers to adoption? So maybe we'll begin with you, Sherry, and some of your experience and what do you mean? What do we mean by reactive versus proactive models of care?
Yeah, absolutely. So today's healthcare system is really based on the reactive approach, where the patient, basically individuals are, showing a symptom, and then that's when they refer to the physician, and then physicians are sending them for diagnostic, screening protocol to identify what is the issue and how to approach the managed care and therapeutic regimen for that particular individual. And that's so-called as reactive medicine. What I think that potentially we have to consider in long term is really to use this molecular fingerprint and signature that we withhold with us when we are born. Really use some of those information to have some, proactive measurement and prediction models where we can, identify individuals that are at risk for certain disorders such as cancer, cardio, or any other, type of category of disorders, and manage their health in a proactive approach, where we're now, don't wait until the symptom shows. Now we have this, information that we can take advantage of, and have a better, healthcare regimen for the patient in their long life, basically.
Yeah. Jim, did you have anything to add on that description, or does that pretty much cover the way you see proactive care?
Yeah, I mean, the word I hear a lot is sick care versus proactive care. And I think the traditional model is very much a sick care model. You get sick, you go to the doctor gives you something to try to fix you. Obviously, many folks now believe that waiting until someone's sick is already too late. And so we're very much in the space of be as proactive and preventative as possible. And I kind of look at the four sort of deadly horsemen, so to speak. You've got heart issues, you've got metabolic issues, you've got neurodegenerative issues. Um, these things, and you've got cancer issues. And so the first thing we do in a preventative world is try to take those things off the table as fast as possible. So heart issues are things that you can actually address, very fixable, very manageable. Metabolic issues, very fixable, very manageable. You can be very proactive. Neurodegenerative, absolutely things you can do. A little bit of a mixed bag. It's a little bit of a crapshoot, although much you can do. And then cancer is simple. The earlier you detect it, the better chance you have. And so I think you have to look at all of those sorts of things, get them off the table or address them first so that you can get into the meat of making people have a better life. And a better life to me, I think words matter. When people throw the word longevity out, longevity is a word that talks about the future 20, 30 years out. So I'm not a big fan of that word. I much prefer words like health optimization because you have to give people positive feedback today. They have to feel better today, live better today. That is actually the key to longevity. The day-to-day feeling better, doing better ultimately is what leads to longevity. There's no magic pill, there's no magic treatment. It's day after day after day, which becomes week after week, month after month, year after year. And that's what longevity comes from. And I do think today we have to be a little careful when we talk about longevity as this thing that's so far out that people are left a little bit wanting, so to speak. And I also
Mhm.
think we got to be a little careful about how we talk about it because that word has become something that feels like something for rich people. You see all of these super rich Silicon Valley guys spending tons of money on quote unquote longevity, and it makes it feel a little bit inaccessible. My strong statement here would be that 90% of the things that go into better health optimization and longevity actually are very democratizable and accessible. And so I just want to make sure people don't get the wrong idea about some of the words we'll use today.
Really, really excellent points, Jim, particularly around the democratization and making it accessible to the larger population. Fady, do you have any comments around this particular concept of being proactive versus reactive in the care?
Yeah, I think it's an exciting time to be in this space. We've got demand from consumers. We've got a lot of capital that's being deployed in this industry. And we're figuring out how to build different platforms and clinic or wellness models to meet demand. So it's a real economy. There's a lot of money being poured into this economy. There's a lot of opportunity to create different products and platforms in this economy. And it's projected to be 10 trillion market opportunity by 2030, probably more across, the entire value chain, whether it's the wellness or the medical grade human optimization protocols. And I think that, there's going to be a lot of winners in this space to meet demand.
Yeah. So how do we differentiate? Like, how do you differentiate your approach from those? I mean, it's one thing to say I'm going to be proactive, but what sort of evidence can we use, Fady, to show that somebody is getting better or that they do have risks that they need to address?
Yeah, so I think a data-driven, evidence-based, biomarker-based approach is what sort of is considered industry standard today, where you have a lot of input from different biomarkers that goes through, these different pipelines and analytic platforms that gives you an output. And then based on that output, you can create different therapeutic pathways and then track outcome through data over time. We're also sort of redefining the threshold for screening and treatments, and sort of creating our own guidelines and pathways in this interesting evolving wellness and longevity ecosystem models away from the traditional models, which have shown that they do miss the various phenomic spectrum of disease. By that, I mean that disease takes years to evolve from a wellness to a disease state. And so how can we in this longevity and wellness economy really uncover phenomic medicine and phenomic phenotypes to influence the trajectory of disease development? And it's very exciting because companies like Molecular You and others are bringing products to market that can provide sort of an evidence-based, data-driven approach to circumvene the risk trajectory of disease.
Well, I appreciate the shout out. That is one of the things that we take a lot of pride in. But Sherry, what differentiates your group? What's your approach to deliver on this promise of proactive care?
I mean, there are, as of now, and I'm talking about within clinical setting, if the individual, for any reason, which is often these days, we perform whole exome or whole genome sequencing for a rare disorder. If any individual at any age goes under whole exome or whole genome, that person is considered as proband who's going under testing. There is a list of incidental finding that was defined by American College of Medical Genetics, where we give an option to those individuals to receive some of the results that have clinical, that could be potentially clinical actionable, to be returned to the patient regardless of the indication of the testing. So what I mean by that, let's say that a kid or a child is being referred to the diagnostic lab to be assessed for autism, for instance. And we look at some of those genes and biomarkers that are associated and linked to cause autism or developmental delay. But then at the same time, because we are interrogating the entire genome of that individual, we also give them an option to know and be aware of any other, life-threatening condition that potentially they can, carry a mutation on. For instance, there are several cancer genes that we can look at and let the patient as well as the family members that are going under testing with that particular individual, whether they carry any mutation. Now we know that, for instance, if that individual carries one mutation in one allele, then therefore that individual has a high risk of developing cancer in their lifetime. So the approach is now, as far as like taking care of the patient, the approach is different. Similarly, for the cardiac genes, there are, some of the genes that are been associated with the cardiac events. So we look at those genes, and if the individuals are interested to opt in, we do provide the profile and the molecular fingerprint of those genes, whether they carry any mutation or not. Other examples are, pharmacogenetic fingerprint. We're all using, many medications in our lifetime. It could be over-the-counter medication, such as pain medication. It could be, medication that manages our mental health. There are medications that can manage any cardiac abnormalities that we potentially have. Then and so on, oncology and other fields. So knowing exactly what, based on your genetic profile, what is the medication that works for you? How much of the dosage should be used? Whether there is a interaction of the the over-the-counter or the vitamin or supplement that you're taking in relation of those medications that you use to manage your disease. These are all information that we can simply retrieve and take an advantage of in order to improve health outcome.
Yeah, so you get that insight through your genetics, and so you can help manage risks over a lifetime. But how do you make it more actionable? Jim, how do you approach your care of and a proactive approach? I know you've got a lot of tools in your toolbox.
Yeah, so I would agree earlier. I do think you got to start with a real assessment of folks as an individual. So lots of diagnostics, lots of data. Then once you have that, it really is how you then deploy your approach. And I will say it's very easy to tell people what to do. What's more important in this space is to actually get them to do it. And so behavior change is sort of the hardest thing in medicine. I went to one of the top cardiologists in Austin once and he said, "Hey, I think we should put you on a statin." And I said, "Well, can we talk about other things?" He said, "No, not really. I don't want to waste my time
Mm.
because you're not going to do it." And I was like, "Well, listen, yeah, I don't think that's the right approach, but that is the traditional medicine approach." So at Humanot, we have a thesis that data is important. By the way, more data than traditional medicine uses. There's obviously things like your blood markers and all of the other things that you test, but you also have to test, are you feeling better? Do you have more energy? Can you actually do the things you want to do in life? Just because your blood markers are improving, you still have to make sure that people feel better and can do more, number one. Number two, we use the word fun and engaging in our clinics. Like you actually have to make this more enjoyable so that people want to engage, want to
Yeah.
follow through with it, want to stick with it, because none of this is sort of a point in time. It's something you have to do over time.
Yeah.
We bring things like community into the mix. So I talk about community as macro and micro. On a macro level, if you're a humanot, you get more out of life, for instance. There's a whole ethos around what it means to be a humanot. So the community inspires people on a macro level. That person is my age. Look at the things they're doing. I love it. On a micro level, we think about that old saying of you're the product of the 5 people you spend the most time with. Well, that's super important in your healthcare journey. So we create tools that allow you to bring important people into your quote unquote health ecosystem. So I would say if your spouse isn't on board with what you're trying to accomplish, good luck. If your best friends aren't on board, good luck. You need them to understand. Now, you got to be careful about HIPAA. You got to be careful about all those sorts of things, but you can do it in interesting ways. And if you put all of that into an interesting ecosystem, you get far greater compliance and far better behavior change. And so, we look at our results at scale. So I'll give you one quick result. 86% of the people that come to us that are pre-diabetic based on all of their markers, within less than 6 months, 86% of them show no trace of being pre-diabetic, and we do it in less than 6 months. So the
Wow,
traditional
that's
medicine would tell you 45% in 2 years. So we're twice as effective, and we do it 4 times faster.
wow. That is a remarkable statistic. Fady, have you got a story you could share with us of just how this proactive approach has really benefited either patients or patients that you know or practices that you work with?
Yeah, so we back founders that are building incredible products and platforms in this wellness and longevity economy, including a platform and a wellness retail longevity experience that we backed in Toronto called Supernatural, through which we give the consumer an opportunity to purchase various biomarkers as a la carte, and we've uncovered a lot of sort of silent diseases through these biomarkers, including prediabetes and through sort of these multi-omic biomarker signatures of chronic disease or evolution of disease. And through imaging, we've also uncovered early stage tumors and brain aneurysms. So it is very impactful. And the feedback that we've gotten from consumers that have sort of been through these products and pathways is that it really changed their outlook, their understanding of risk, and it ultimately created a positive feedback on how they live and how they want to live down the road.
Yeah. I mean, that cancer one, that's a tough one. It's so important that we do catch it early. And Sherry, you mentioned that you've got some genetic screening that can identify certain risks to cancer. Do you have some examples of how you've used that technology to help either detect the cancer or some other condition early?
Yeah, absolutely. I mean, we usually do whole exome or whole genome sequencing to identify individuals at risk. But I think something else that I was gonna, get into is some of the, challenges that we face is really the insurance coverage that, and unfortunately, as of today, at least in USA, screening, tools are not being reimbursed by payers, and therefore, people that are health cautious are willing to sort of like, pay out of pocket and cover the, get the cost or absorb the costs and still get the information to manage their, the healthy life. But because of the lack of insurance coverages, we have to deal with so many challenges. The other issues that I think potentially we will not have in the future is the confidentiality and the HIPAA compliancy. Patients are fearful that by going through some of these screening tests, their information will not remain confidential. And I think, some of these new technologies, such as like quantum, blockchain technology, can really help us to address some of those, issues that we face as far as, maintaining the confidentiality and protecting patient data in the future. So hopefully we're moving toward the right direction as far as, like providing some of these screening tools directly to patients.
And
Yeah, I'm
can I
gonna.
add, can I
Yeah,
add
go ahead,
something on a
Jim.
couple of those points? So number one, consumers are confused. There are so many sort of slices of healthcare, and putting it all together is really hard for them. Knowing what the best practices are is really hard for them. All of this is incredibly fragmented and difficult. So cancer screening, there's lots of different ways to do cancer screening. I would make the statement that many of the ways out there are inadequate. And so if you just do a blood biopsy, you will get a lot of false positives. That's horrible. You know how much that scares people? So, what's a better way to do
Correct.
it? So, take a blood biopsy, add the genetic
Yeah.
testing, and then do a full body scan. And by the way, I'm not in any way, shape, or form saying anything negative about Sherry's approach. I'm just saying that people don't know what they don't know. And so, a lot of times they'll jump to the wrong solution, not knowing that there's a better option that you can layer on. So, that's number one.
Right.
Number
No, that's a great point, Jim. Maybe I should add that, liquid biopsy does have lots of challenges as far as interpretation. So you're well, and I mean that was a very fair statement that you made. I don't personally think, and I know it's growing field. Many laboratories that are mainly, doing the screening in the commercial setting, not in the diagnostic setting, are doing liquid biopsy for cancer screening. In my opinion, as a board certified clinical geneticist, I'm not sure if this is the right approach. The best approach is really, to look at the hereditary pattern and identify individuals that are, carrying one allele from at least one parent, which basically increases their chance for manifesting cancer at some point in their lifetime, which is very
yeah.
different than, doing liquid biopsy.
Yeah, so I couldn't agree more with Sherry. And also, like I said, I like layering. The second thing I wanted to address was the out of pocket. We're a
Yeah.
cash clinic, and what I oftentimes have to do is reorient the way people think about things. Every American that has health insurance is paying out of pocket. They just think about it differently. They will say, "Well, I have insurance through my work." Well, every paycheck, you have money coming out of your paycheck. The average family deductible in the United States now is $8,000. So in addition
Mhm.
to what you're paying every month, you also have $8,000 deductible. So please understand you are paying for your health care out of pocket. And so what are you getting for that? And so the third thing I will say is that we're doing something very unique in the healthcare space. In the first quarter, we will launch a guarantee. Nobody talks about guarantees in the healthcare space. But our sort of ecosystem generates really amazing results on any of the big issues you're talking about. Now, the guarantee is not arbitrary. The guarantee requires a commitment from us as practitioners on what we're going to do for you. It also requires the patient to sign up for a few things. So, for instance, you have to sign up to understand the principles of being a humanot. A humanot is not just a random thought. It's these are the ways you live your life. And it does embrace proactive, preventative things. It also recognizes resilience. A bad day should not sideline you. So we all have bad days. You got to get back. Don't let a bad day become a bad week, et cetera, et cetera. In addition to signing that, I understand what it's like to live like a human. We have what we call an accountability protocol. These are the things that you agree to as a patient. So, for instance, you agree to a wearable device. How are we going to monitor you from a coaching perspective if we can't see your data? How are we going to know you're sleeping well? Because people lie all the time. How'd you sleep last night? Great. How'd you move yesterday? Awesome. No, you didn't. You slept 4 hours and you moved 4,000 steps yesterday. So when you think about this in a much deeper way and you put the tools in place and you put the ecosystem in place, you can have a very, very different approach to healthcare in this country. You can reorient the way people think. And more importantly, you get amazing individual outcomes. And I would actually say you can bend the cost curve for the suppliers of healthcare, the corporations, and that sort of thing. So we're incredibly
Yeah.
proud of our approach. And we're also proud of the fact that we will be doing it at scale, similar to what I did at Restore, where we went from 0 to 250 locations. We'll open 100 locations in Humanot over the next 3 years. Those are already on the development roadmap. So this will be something at scale. Scale matters in this. Scale
Yeah,
matters.
I think you're raising a number of great points, Jim. And I actually just want to go back to the one you made about the sense that there's money to be saved here. It seems like huge amounts. PwC and Deloitte just put out huge articles on reviewing how we can improve our cost of healthcare by improving health and focusing on keeping people healthy longer. But the challenge, as Sherry's brought out, is who pays? Like why? And it, in our sense, I think it's quite common way you're thinking is that it's you're going to benefit if you pay, but why aren't the insurance groups? The insurance seem to have a lot to gain here. I don't know, Fatty, how do you guys approach this this who pays? Like how do we get across that barrier to adoption?
Yeah, I think insurance are looking closely at this. I mean, we've seen some insurance companies adopt different wearable technology to gamify the underwriting of insurance. So that's a good first step. I think they've also shown interest in age clocks and how they could potentially underwrite insurance based on someone's predictive risk from these age clocks, including DNA methylation, biological age risk clocks. We're seeing employers move in that direction. We're seeing it with women's health, like the partnerships that MIDI Health and others have pursued. So we're seeing employers pay for proactive healthcare management. And I think ultimately, once the industry of longevity and wellness sort of solidifies and shows real value for the end user, we're going to see a lot of employers and insurance companies cover that.
Do you think it's just not enough evidence yet for the insurance and the employers to get fully behind?
Well, it's still a very nascent industry with no hard outcomes, and it's wild, wild west, right, as we see it. But I think there's going to come a time when there's really solid players and M&A consolidation in this space that's going to show great products and value to the end user. And certainly the industry is moving from reactive to proactive. There's money and there's great builders in this space. So I'm sure that we're going to see something great happen in the industry. I just think we're still in the first inning.
Yeah,
Okay.
I take our company,
Kim,
people think of us as a consumer offering. We have a corporate offering too. We go to corporations that have employees and we say, here's our approach. By the way, they have a survey on their employees. Most companies, 20% of the employees drive 80% of the costs. Great.
Hmm.
Let's go do some diagnostics. Let's put them into a program. Let's include all of the things that we've talked about. You can absolutely bend the cost curve for these companies. So now you've got companies putting money towards it. You've got the individual consumer putting money towards it. And at some point, the insurance companies will begin to invest more and more of it, to Fadi's point, as we get more and more data. But I don't think the longevity players, quote unquote, are particularly thoughtful about it. I think a lot of times they have an offering for part of the company. They have an offering for the executives. They have an offering just for the females. They have an offering, for different slices of it.
Sure.
So
More fragmented and
yeah.
not a holistic approach. Yeah.
it's more
And Rob, I
fragmented.
think
Go ahead, Sherry. Sorry, Jim.
Sorry. And then I was gonna just add that I think I agree with everyone in this conversation. I did a little research about like why insurances are covering it and why employees are basically the reason why employees are covering the cost for this type of test. Like for instance, Illumina does cover and pay for their employee to go under GRAIL testing, which is a biomarker every year, right? Because they look at the long-term investment of like how much they're gonna save, and their employee are usually staying with them for a few years, an average of, I don't know, it depends like which organization. So it has a cost benefit for the employer to offer this test and cover the cost for their employee. Whereas when it comes to insurer like the commercial payers, they basically the maximum of like a time that they can invest for their beneficiaries, at least in US, it's basically a year. Usually after a year, patients are changing their plan. So they really look at the short term revenue margin. So they don't want to have a long-term investment for those beneficiaries for a few years, because they know that potentially that individual may not be signing up and staying in their network next year. So they look at short-term wins. I mean, I truly believe that we do need to have a universal system where we capture all this information. So regardless of like where those individuals will land and go between different payers, between different employers, this information is a long time, lifetime insurance that can be leveraged and used. And if we just have, the universal inventory where all these data are maintained in the secured way, then it doesn't matter where those individuals will end up. We can always use those information to advance their health.
Well, I was going to mention it because you brought it up earlier, but using tools like blockchain where people can own their own data and be in control of their own data has a lot of potential as well. Yeah. I do want to just going to pause on our discussion just for a second to remind the audience that we are welcoming questions. So if you do have a particular question you'd like to direct to one of the panelists, please put it in the Q&A section, and we'll get to those as they pop up towards the end of our discussion. So I'm going to shift a little bit back to you, Fadi, and just ask you, as we're starting to get over some of these hurdles of payers, how do other practitioners get into this space? I mean, it does seem to be the ultimate what a physician would want is to help keep their patients healthy longer so that they suffer less. But what advice can you give them to get into this world of proactive care?
Well, it's a very tough challenge, right, for the traditional healthcare model to be losing, clinicians for other care models like the proactive human optimization models. There's a mismatch between demand and supply in the traditional care. Well, that's an issue that we need to address first. And then how do you train physicians to be open-minded about the wellness and longevity economy? There are different universities and initiatives out there that offer formal training for physicians that want to seek skill sets in longevity, including the Geneva College of Longevity Science that has a master's program in longevity science, and the A4Ms and others out there. I think that's a good start. But you really need for the clinician to see value in wanting to acquire these specialized skill sets in functional medicine and longevity medicine. And I think that's a good entry point. Longevity docs out of New York just recently had a peptide mastermind, which got a lot of attention for those clinicians and healthcare providers that want to hone their skill sets in this very interesting and innovative space. So I think we're going to see more and more traction. But again, the demand and there's a major demand and supply mismatch in both the traditional care model and the proactive care model. And I don't think we're going to meet demand anytime soon.
Yeah, and we have such a shortage of physicians as it is. I guess we've got like a 20% shortage overall, I mean, globally. And they're only getting 5 minutes. How can they possibly put more time into the care of an individual? Jim, what would your recommendation be for the people who want to get into this space?
Yeah, I think there's a long line of people that want to get out of traditional medicine and want to practice this type of medicine. So there's that sort of just generic line. I think a lot of those folks, they get into it and they realize this is more, they're biting off more than they thought they were. And when you get into this proactive, preventative thing, it's not a point in time type of care. It's all the time.
Yeah.
It's because it is proactive, preventative. It's about movement. It's about what you're putting in your body every day. And so you get these little cult of personality businesses, I call them, where you get a clinician. I really want to practice this sort of functional, preventative, proactive type of medicine. They get some tools that are relatively generic. They get some AI agents and a few other things. But because they're a small practice, it's really hard for them to understand the breadth of what needs to be done. And they almost become a prisoner to their practice. They're on a constant treadmill and people are hitting them all the time. And so it's where I go back to the word scale matters.
Right.
That from that generic line, we have an unlimited line of doctors that want to come practice at Humanot. Number one, they've seen the types of things we scaled in the past, so they know they're coming to a business with real adults and a real approach. Number one. Number two, they see that it's a real ecosystem on the clinical side. We have top doctors and, in women's health and sexual health and hormone health and regenerative medicine. And so they want to be a part of that ecosystem because they know they will be supported when they don't know everything. And even some of the best functional medicine doctors that come into the Humanot ecosystem, they require massive amounts of training. I'm shocked at how unprepared they are for this type of medicine.
Interesting.
So we have to have all kinds of tools. We have two customers, we always say. We've got the consumer and then we have the clinicians. We have to
Okay.
make the clinicians able to do their job and able to do it efficiently. And so where that cult of personality practice can do X number, we sort of have a metric of about 6 to 7X with the same amount of practitioner capability. So it matters the tech stack, it matters the ecosystem, it matters the
Sure.
support systems. And I think more and more folks are going to want to practice this type of medicine, but careful what you ask for if you don't have all of the things that you need to do this well.
Yeah. Well, and the other thing you mentioned, and which I think is super important, as we go into this, is there has to be a willing recipient on the other end. You need a participant to participate in this healthy longevity. It cannot just be a prescription. It has to be something that somebody is willing to take part in and make those changes in their lifestyle so that they can actually experience the benefits of it.
Yeah, I wrote a book called The Power, Life-Changing Power of Right-Away Wellness. And the idea is you have to give people results immediately. They
Yeah.
have to feel better quickly. Humans are not wired to wait for it. And so we have all kinds of ways that we get good progress really quickly and we get people into a virtuous cycle. The more you do, the better you feel, the better you feel, the more you do. When you get
Sure.
someone in that virtuous cycle in an engaging, interesting environment with all the right tools, you actually can take someone who previously would have been non-compliant and make them incredibly compliant. So there are ways to do it, but to your point, you have to be willing to put a little bit in it as a patient.
Sure.
And so we try to find ways to get
Yeah.
them going.
Yeah. Sherry, did you have you had any of these challenges of getting, enough practitioners, or how would you get people working more with your genetic screens? And then I also wanted to just throw one more question at, is this one of the big opportunities for women's health that we're entering right now? Because we can really start to monitor and follow through the changes in life.
Yeah, absolutely. I think, because of the challenges that we have, we really are more focused on diagnostic, but rather than just, providing a screening tool for the individuals. But believe it or not, the patients, as I said, I think that the individuals themselves are becoming more health cautious. So they care for their health. They want to know if they are at risk for any life-threatening condition. So because of that, I think to answer your questions, we're getting more feedback from the, you know, like individuals directly rather than providers willing to, you know, order a screening test for their cohort. But in my opinion, like, you know, if someone you asked earlier, for those, you know, companies or individuals or professionals who want to get into the realm of screening and proactive health, well, what is the recommendation, or what do we suggest as those like who started companies that are providing such service? I think, you know, getting involved with the advocacy, you know, activities, and raise awareness, and, you know, and talk about the value model that you are bringing into the health the area. I think that those are really like a first step that we all need to do at this stage. We did discuss that the universities right now lack of, you know, appropriate, basically educational curriculum for many of these topics. So, you know, healthcare innovator that are starting taking an initiative to advance um, longevity or, you know, proactive medicine. I think we are all playing the part to raise awareness and do lots of advocacy work to, you know, let everyone know that what is the value of that we are bringing in order for you to have a healthier lifestyle.
Yeah. Fady, did you have a comment? You had your hand up.
Yeah, I think that was by mistake, but I'll just add and
Oh,
say that there might be a component of being risk averse to being in the proactive health care industry by a lot of physicians, because some of the products, including regenerative therapies and others, are still sort of considered experimental, and some people may not want to risk their license or their career without sort of clear regulatory guidance. And I know there are some states that are very proactive with regulation towards these sort of longevity therapies, like Montana, Utah, Florida. But I think we need to reassure physicians that this is sort of real medicine, it's precision medicine, and that we're going to get hopefully more and more clarity on the regulatory landscape of a lot of these therapies. And I'd appreciate Jim's thoughts and experience from sort of how to navigate the regulatory landscape of such experimental therapies.
Yeah, I'll say two things. First of all, United States is essentially 40 different countries when it comes to healthcare regulation. So I will say, until you've been through that, I think people underestimate that. And we certainly have been through that in the past, number one. Number two, we have sort of a construct. Number one, whatever we do, do no harm to the patients. That's our most important principle. Number two, do no harm to the reputation and or license of the clinical team. That's very important, obviously. And then three, make sure we're staying abreast of all of the things that we should and shouldn't be doing. And I think that, once again, going back to my earlier point about scale matters, I think doctors particularly appreciate knowing that those things are being handled in the right way. I've had many practitioners come to me and say, I was at a previous practice, I can't work there because I don't feel safe. And, so we have a infrastructure that includes very experienced folks that understand the regulatory and compliance perspective, not generically, but across the country. And we have a very good understanding of things like regenerative medicine, what you can and can't do. I oftentimes say, for instance, regenerative medicine is an FTC problem, not an FDA problem. You can actually do far more in the United States than people think. What you cannot do is you cannot make claims. And you cannot make claims about certain things in regenerative medicine or many of the other things in longevity medicine. But people don't understand that. They're trying to sell. And when you're trying to sell and you're not disciplined, you inevitably make claims that are not legal. And that's what gets people in trouble more than anything. And I always say it only gets you in trouble when one of two things happens. Number one, you get big. No one pays attention when you're tiny, or you hurt somebody. Doesn't matter how big you are. Once you hurt somebody, and so if you're not doing it the right way and you get big and or you hurt somebody, you will be in trouble. And I also say, because I hear other doctors say, well, we're small, we'll do it this way. When we get bigger, we'll do it a different way. I'm always like, you will do what you have practiced doing. If you're doing it wrong when you're small, you will do it wrong when you're big. And so, if you're a doctor, I think you just have to be very judicious about the environments that you put yourself in and the folks that you work with, would be the way I would say it. But this is like a 2-hour conversation alone talking
Yeah.
about regulatory.
Well, and I think you touched on a lot of great points, but one of the challenges that we face, Fatty, is everyone is an N of one, and our healthcare system is really meant to generalize. And once we start to do this generalization, so really every moment a doctor is caring for someone, it's an experiment. They give a person a drug. They don't know how they're going to react, but they, based on all the evidence they've got in the past, they think it's going to work. So I think there's a lot. This is a 2 to 3 hour discussion and probably a few beers. But I did get a question from our audience that I wanted to direct to you, Fatty, which is, where do you, given your position, but where do you see the greatest opportunity for innovation in healthcare? Prevention, diagnostics, or therapeutics still?
Yeah, well, what a an exciting space to be building in healthcare. And I think I would pick today I would pick diagnostics, because we've got tools that are out there today that can make a huge impact on risk trajectory and intervention. If you were to ask me this question 5 years down the line, I would definitely say therapeutics, and therapeutics that will potentially have a major impact on our longevity, especially small molecules and gene therapies. The second point I want to add and double down on are age clocks, including their predictive value. So more expanding more on the diagnostics, or the bullish stance on the diagnostics platforms. I think that what we're going to be seeing over the next 2 years are very well published studies looking at the intrinsic predictive value of age clocks, particularly multi-omics age clocks, and predicting mortality and disease risk. And I think that will be a game changer for the industry, because it will grab the attention of insurers and clinics and healthcare providers and so on, in using them for as a risk predictor, and then as a biomarker to look at various interventions in the clinic.
Okay, well, that's interesting. I always been challenged by some of the H clocks because they tend to look at just one system, like methylation of your white blood cells. That doesn't really tell you anything about your other organisms, but it tells you a lot about your white blood cells. And so I'm wondering how you could do those kinds of clocks. But that's a good. Maybe you have some thoughts on that, Sherry. The big opportunities in health, is it going to be in prevention, diagnostics, or therapeutics?
And yeah, I guess that, in my opinion, maybe not today, but at some point, healthcare system will incorporate some of those omics data. And now those data will be, with the advancement of technology, and then EMR integration, where all the patients and the genomic profile is now incorporated in one in database. And we have a super, hero computation power of AI and quantum. And I think we're going to have a lot of new findings in the next few decades, where as of now, they're not, basically it's locked. I guess that's what I can forecast that is going to happen in the future, and we should get a better assessment about, like, what are those biomarkers, as far as, like, that are contributing to the longevity or health metrics, or any other thing. I would like to mention something that I know that we were talking about some of the challenges as of today, but 2 weeks ago, the first newborn genomic initiative has been launched, where the plan is really sequence 30,000 newborn, perform genomic. I guess that the plan is to perform whole genome sequencing on all of those. So to me, that's really a good start, because the field is really moving toward that direction of, like, preventive approach rather than reactive.
That's an interesting concept. So what did you see gene editing coming in to the rescue, and when you do identify it, or do you need a phenomic companion to look at that? Because the genetics alone, will that give you all the information you need?
I guess the purpose for this particular initiative is to look at, what are those, individuals who are at risk, But obviously, incorporating some of those AI technology, we may get there when we can now target and, figure out like what would be the therapeutic approach that best works for those individuals. That's something to be, I guess, to be discovered later. I cannot make any comment as of now.
Okay.
Yeah,
Yeah.
can I add one thing? I would
Yes,
say
please.
I'm not going to get into the cool science. Sherry and Fadi definitely did that. But what I will say is that we are putting a lot of emphasis on going back to the basics. And it's
Mm.
an area that doctors are very ill-equipped to handle. And that is literally movement, sleep, nutrition, stress reduction, connection, community. That is for us 80% of it. If you aren't doing those sort of things, the rest doesn't matter. And I don't think that the healthcare system in America, or most of the world for that part, is really good at understanding how to get people to do the foundational things first. And so we jump right to the things that we're going to put in people's body before we get them doing the foundational stuff better. So, when you have a clinic like ours, you have to do all the cool stuff. We have high dollar memberships, we have high dollar services, but we do have two principles that I think are really interesting. One is if you're not doing the foundational stuff first, we will not let you do the fancy one-off stuff, number one. And then number two, I'll use hormones as an example. If a man walks in and says, I would like to do testosterone replacement, obviously we're going to test them. But before we do anything, our first question is, where's your partner? And we just fundamentally believe that people are rushing too quickly to, give them, hormones. Like, what about your wife? What about if I help you and I don't help her? I've created a pretty bad situation. I've created an existential issue. So I just think that healthcare's got to get back to having a little bit of heart and focusing on the foundational stuff before we go overboard on all of the cool science that's coming. And there's no one more interested in the cool science than me and Humanot, but we really do like to lean into there is so much that is accessible to you, available to you, if it just is kind of made understandable and meets you where you're at.
Yeah, and you can show that there's benefits to the changes that are being made. Absolutely. Yeah, yeah. Well, we've got about 4 minutes left. I've got one other question that was asked, and maybe this is a good one that one of the audiences put up is what role do partnerships with technology companies or diagnostic labs play in your success? And maybe I'll start with you, Fadi.
Yeah, I think a major role because we're moving towards sort of a big omic, phenomic medicine type of sort of a platform that connects consumers via clinics with those labs. And so we need lab partners that have the technology and the operating systems that make sense of big data to make our jobs easier at delivering big data for the end user. So we're looking for great products like Molecular U. We're looking for dashboards and operating systems and AI agents and co-pilots and apps and dashboards that will be sort of a smart business solution and a turnkey for providers to be able to translate big omic data into actionable insights.
Fantastic. In this whole discussion, it's the first time we brought up AI, which has got to be a very rare thing in today's world. Sherry, do you have any thoughts on the partnerships and how they can accelerate, or what's the best way to approach partnerships for success?
Sure. I mean, in my opinion, having an access to large data set at the population scale is the fundamental step toward the precision medicine, advancement. So as Fadi said, once we have, having an access to the data, then now we have a platform that we should be able to, handle all of these omics approach and put all those, data together and interpret it in a way that we can translate it to human health.
Mhm.
So as of now, lack of access to data is another challenge that we are facing at the population scale. there are lots of initiatives that are happening and at separate entity, but what happens often, the data is basically being withheld exclusively for a particular organization, and that really is blocking an advancement in precision medicine, which needs to be addressed.
Okay,
But
so more
but
partnership,
obviously,
data sharing, yeah.
exactly, data sharing is integral for many reasons. Obviously, how to analyze all of these data and not to just rely on a smart cohort of the data and apply it to the large population. Instead, having an access to large population and having a good analysis pipeline that can handle analysis of a large data set and
Okay.
make the biological sense of it.
All right, thank you. And Jim, we've just got a minute left.
Sure, I'd add a couple things. It'd be nonsensical to do what we do without a ton of partners, lab partners, diagnostic partners, technology partners. There's some opportunity for vertical integration at scale, but that's when you're pretty big. But the way we think about it is many of the systems in the healthcare space are incredibly obtuse and difficult to work with. And so we spend a ton of time on the presentation layer above all of the systems. And so at the presentation layer, we can pull the data we need, we can provide a better experience, we can create AI enablement, and we can let the individual sort of technology pieces be dysfunctional. We can work with labs that have more or less sophisticated APIs. We can do all of that because of the way we're approaching it. But we're certainly not trying to replace all of these partners because that would be nonsensical. They're essential. There's too many of them. But down the road we'll make some bets and maybe there will be a piece or two that we'll bring in-house.
Fantastic. I want to thank you on behalf of the audience for joining us today. I know you've all got busy lives and really appreciate you taking the time out of your day, Jim, Sherry, and Fadi, for joining us today. And I hope our audience is as appreciative as I am. And we're looking to do a few more of these discussions and opening up this channel for really figuring out how we can start to turn the corner on health and make health the focus rather than treating sickness. So thank you again, and I look forward to working together with you all.
Thanks for having me. It was great being on the panel with you guys. It was really a treat. Thank you very much.
Likewise.
Thanks for the opportunity.
Take
Thank
care.
you.
Thanks, everyone.
Bye.
Bye now.